Hello, my name is Charles Goldfarb, and I'm joined by my co-host Alexander Aleem for the AOA's podcast, Lessons in Orthopedic Leadership. We're pleased to invite you to the 2021 AOA Virtual Annual Leadership Meetings. Contribute to critical issue conversations with orthopedic thought leaders, sharpen your leadership skills, and network at our fully virtual dynamic experience. Sessions will begin in May and culminate with an intensive agenda taking place the week of June 8th through June 12th. All are welcome to register and to attend. You can learn more about the full menu of annual meeting offerings by visiting aoassn.org. All right, I've been excited for today's podcast for so long as it is a topic near and dear to my heart, social media and orthopedic surgery. It is also a first as we have three incredibly well-qualified guests who are each experts in social media and will share the benefits of an active social media presence, the challenges of doing it correctly, the do's, the don'ts, their favorite platforms, and so much more. To start, Alexander and I welcome at Joseph Shue, MD, at My Mom the Surgeon, and at Mary Mulcahey, MD. So welcome to everyone, and I'll turn it over to Alexander.
Yeah, excited to have everybody. This is the most guests we've had on the podcast at once. We'll go through some brief introductions here. I'll start out with Dr. Joseph Shue. Dr. Shue is the Vice Chair of Quality of Atrium Health's Musculoskeletal Institute and a Professor of Orthopedic Trauma and the Director of the Limb Lengthening and Deformity Program. He originally is from Baton Rouge, Louisiana, and is an honor graduate of the United States Military Academy. Dr. Shue served in the U.S. Army and deployed in 2006 to Baghdad, Iraq. He spent the majority of his military career trying to optimize outcomes for limb reconstruction patients. Much of Dr. Shue's research now involves guiding safe opioid prescribing and true multimodal pain management for clinicians.
Next up is Mary Mulcahey from Tulane University. A New Hampshire native, Dr. Mulcahey received her Bachelor of Arts in Biochemistry from Dartmouth College in 2000, her Doctor of Medicine from the University of Rochester School of Medicine and Dentistry in 2006. She completed her orthopedic surgery residency in 2011 at the Warren Alpert Medical School at Brown University, Rhode Island Hospital. She then completed a fellowship in orthopedic trauma at the same institution, followed by a sports medicine fellowship at San Diego Arthroscopy and Sports Medicine. Dr. Mulcahey was one of only 4 orthopedic surgeons to be selected for the Arthroscopy Association of North America Advanced Arthroscopy Traveling Fellowship in 2016. Welcome, Mary.
And finally, we have Dr. Jennifer Weiss. Dr. Weiss is a New Jersey native and the daughter of an orthopedic surgeon. She attended Williams College, so big shout out to Chuck for that one, and went to medical school at Mount Sinai School of Medicine in New York City. Dr. Weiss trained in orthopedic surgery at Baylor College of Medicine in Houston and went on to a fellowship in pediatric orthopedics at University of Southern California. Prior to joining Kaiser, she practiced at Children's Hospital Los Angeles and Santa Monica Orthopedic Group as director of the Pediatric Sports Program. Now she's the head of the AAOS Communications Committee. So welcome, everybody. We are super excited to have everybody. I think I'm admittedly probably the least experienced on social media when it comes to the profession, and I don't want to make assumptions, but I'm also think I'm the youngest person on this podcast, which is ironic. But I think for me, social media has never been something that I've thought of as professional. It's always been a way to catch up with friends. It's always been a way to kind of keep tabs on people. I remember in college when Facebook started, and it was like exclusively East Coast colleges, and I was super excited when Hopkins got the invite. Why don't we start with Joe and then Mary and Jennifer? Why is social media an important platform for us to consider in a professional setting?
Yeah, I mean, I guess I would say the first way I got into social media was, I was kind of urged into it because we had been thrust into a leadership position with respect to safe opioid prescribing and pain management. And so I was really asked by some of the people at our health system to really kind of project that teaching and get more involved in it. And so for me, it started out as a scientific educational type of a thing. And then it actually became fun as I started to meet people like Jennifer and Mary virtually on social media. And, you kind of get to meet them one day in person. You're like, oh, I really feel like I know you. And so it's completely evolved for me from really coming from that perspective.
Joe, what is your platform of choice before we turn it over to Mary?
I tend to use Twitter just because it's easy and brief. It for a full-time clinician, as well as having other things, I think it's something that's very easy to interact with in a very short, efficient way.
Perfect. So Mary, give us your kind of background, how you got into it, and what your favorite platform is as well.
I guess first too, I'd like to say thank you so much for the opportunity to be here. I'm really excited to be here with the group and Jen and Joe, and I echo Joe's comments too about, I told him before we started this that although I've never met him in person, I do feel like I know him too. So you really make amazing connections via social media, and I love that aspect of it. How I got started, I mean, I guess, I had always used Facebook a little bit more to just like share pictures with family who are in different parts of the country. But really my sort of jump into social media and using it professionally started probably about a year and a half ago. So like the summer of 2019. And interestingly, it was at the encouragement of a couple of medical students that were working with me that summer. And they said, Dr. Mulcahey, like, you've got to get on Instagram. There are tons of orthopedic surgeons there. And they showed me like some of the stuff that other surgeons were posting. And I was like, oh, wow, that seems actually pretty cool. But I was initially sort of intimidated, like not knowing, like, how do you do that and balance it with everything else that we're sort of juggling. And so I just sort of started gradually, and then you kind of get hooked. It's a lot of fun. It's a way to, connect with colleagues and to network and to share information, educationally, some just fun stuff, other professional things you're doing. And so that I started initially on Instagram. And so that was over that summer. And then in the fall, like in September or October of 2019, I went to a leadership course. And one of the breakout sessions there was on like social media, in medicine. And I was like, okay, good. I'm going to learn more about like some of these other platforms. And all they talked about at that was Twitter. And I said, oh my God, like I'm not doing anything on Twitter. So that's really where I started using Twitter. And just sort of, it's like first it was like kind of going on, see what other people are posting. And then you sort of get used to it and start like tweeting, retweeting, sharing, like, and then you just get really good at it by doing it. And I learned so much from my colleagues too, from Joe and Jen and many others who post frequently. And so we learn from each other. And so in terms of my platform of choice, I mean, I like both Twitter and Instagram for different reasons. Like Instagram, I really like because you can put more pictures on there. And I love pictures. If anybody has noticed that, I love pictures. And so I think you could post 7 or 8 on Instagram. And on Twitter, initially when I started, like I could only figure out how to post 1 picture. So I was really excited when I figured out how to post 4. But I like that aspect of Instagram. I think it allows for some different types of interaction. And then Twitter is great because it's kind of quicker things like Joe was saying. And so I think they both have their benefits.
Perfect. All right, Jen, enlighten us with your background and your favorite platform.
So I definitely started social media for fun, and I started to follow some people who clearly had an intentional message. So what I started to do was Facebook was fun, and that was about my family. And then I joined Instagram and Twitter. And my message there, as you might guess from my handle, is that I wanted people to see that you can be a surgeon and be a mom. So I intentionally crossed my family and social personal stuff with my professional stuff, which we can get into later. A lot of people recommend that you have different accounts for those things, but I don't for that reason. I love Twitter to be snarky, and once in a while I am heartfelt, and it surprises people. Instagram, I tend to be, more of, as Instagram is intended, there's more room to say more things. And I've been very influenced on Instagram by Nancy Yen Shipley, who has become a dear friend, and she is just a maven of crossing the intersection of the funny and the personal and the heartfelt and the professional. And then I will also add, so Twitter's my favorite. I think Instagram is a place where medical students, especially young women and college students, are going to see the stories of women professionals. So I'm trying to spend more time showing that on Instagram. And then most recently, I have joined Clubhouse, which is an audio version. It's rooms. It's like an old-fashioned salon, and it is a very interesting platform. And then lastly, what I'll say is I think it is important that orthopedic surgeons are out there on all of these platforms, even TikTok, because there's so much misinformation and disinformation that if we're not out there giving the correct information, so much goes unchecked out there.
I think there's a lot to take from that. I think maybe the thing that I've struggled with is, and I think Jen, you mentioned this, is just the number of platforms that are out there. Twitter, Instagram, TikTok, Snapchat, LinkedIn is even something that we don't really talk about a lot. And each one has a different audience. And so if you're really trying to grab all those people, you got to kind of have multiple presence. And that can take a long time. So, maybe Jen, how do you prioritize what platforms, or do you think it's important to have kind of a presence on multiple platforms?
I think that if somebody's just starting, I think it's good practice to choose one and figure it out and kind of find your people. I think as you get going, intentionally deciding who you're going to be on each one, and it may be that you're intentionally the same on each one, but for me, I know if I've got something quick and snarky to say about my husband and his obsession with golf, that's going to happen on Twitter for me. If I have something a little bit more heartfelt to say that's got images, I'm going to go to Instagram with that. And I personally have like 5 times the number of followers on Twitter. So if I have something to say that I want to get out there, I leverage that. And I think that that's a way to do it. And I also think that creating, like Joe said earlier, creating a Twitter post is like a minute for me. And that will happen very easily. Whereas Instagram, I'm really thinking through the aesthetics, or at least I should be.
Mary, you want to go next?
Yeah, I agree completely that there are tons of platforms, and many of which I still am not familiar with. So, TikTok is one of the newer ones. Like, I have not done anything with TikTok yet, but you're absolutely right, Alexander, that the different platforms target different groups, and I think also are used by different professions. So I think like LinkedIn is probably more scientists, et cetera, and they all have their benefits. At this point anyway, not looking to expand on other platforms. Like Twitter and Instagram keep me quite busy. And in terms of, I guess, who I am or what I post on the different platforms, I share pretty much the same type of information. Like Jen, brought up a good point. It's like, are you a different person on the 2 different platforms? And for me, I think I'm largely the same person, with the exception, you can share more in terms of images, and you have more text. Like, you can put more text in on Instagram. So that allows you to share a little bit more information, but largely my message is the same on the 2. I personally have elected to have my Instagram and Twitter accounts be entirely professional. And that's a very broad definition. If anybody sees my stuff on Instagram and Twitter, I will post stuff about a presentation or a publication, and I will post stuff about fitness and health, because those things are all very important to me and are tied to sports medicine. But yeah, for me, I use them fairly similarly, with the working within the limitations of the different platforms. So of course you have the character limit within Twitter. Another limitation is you can't post videos and pictures in the same tweet. So it's kind of like, if you want to post, if there are 2 or 3 pictures, post that and not the video. So you just kind of learn what things you can include in your different posts.
Yeah, jumping off those things, I'll address LinkedIn. There are times that I use LinkedIn when I really want to connect with people outside of medicine. Twitter, my Twitter followers and the people I connect with, it tends to be in a very medicine thing. So some of the things that we want to connect with outside, Mary mentioned some of the scientists. So we, if we're posting for a job for a basic science research or something like that, but also if I'm talking about something, especially like some of the opioid stuff or diversity, inclusion, and equity stuff, that I really feel like needs to get outside of what we do in orthopedics, I may post or like something on LinkedIn, especially some of the leadership stuff. For me, it's a really great place to learn about leadership outside of medicine. I have a military background. A lot of my veteran colleagues that are business leaders are on LinkedIn, and there's really a ton of information and education on leadership that you just can get directly from LinkedIn. And I'll chase down and buy the books after I see someone post a quote I'm on LinkedIn. So that's some of the stuff that I use it for. It's really interesting. Most of my social media is professional. I've really steered away from Facebook and Instagram and those things, but I'm actually now about to start a Facebook account, because what we found is I do osseointegration for amputees, and it's a very, very small group, and the patients want to actually interact with each other to build self-efficacy with each other. And so we're creating a Facebook group for our osseointegration amputees, and they want me to join and participate in it with them. And so, I just thought that was a really neat thing where you can have these closed groups. And so, if you'd have asked me a week ago if I was going to be on Facebook, the answer was probably no. But I can tell you that sometime in the next 1 week, I'm going to do it, because we're launching our Facebook group for osseointegration.
I love that you kind of brought Facebook in, because that was going to be my next question. I have to say, I think some of the listeners who are not social media experts like you guys may be feeling a little intimidated. So we do need to bring it back and explain that it's not intimidating and it's easy to break in. But Joe, my experience with Facebook has been exactly that. Of all the platforms we've talked about, it is the one that is most patient focused. And often allows you to relate with patients in a very different way, at least in my experience. Mary and Jen, I don't know if you guys have used Twitter or Instagram or maybe Clubhouse to talk to patients, or are most of your conversations really about peers or students or residents? How do you think about your audience? And again, it goes back to the purpose, which I think we've heard a little about each of your purposes, but who is your audience? Mary, you want to start?
Sure. That is a fantastic question. And I think the audiences, as we've discussed a little bit, are definitely different on all the platforms. On Instagram, I feel like is more of, like for myself as a sports medicine surgeon, right? It's the teams. Some of the teams that I cover are on Instagram. Physical therapists, like other local kind of athletic trainers are on there, medical students for sure. So I interact with a lot of those people on Instagram. On Twitter, it's much more of my orthopedic colleagues. So orthopedic and medical colleagues in general, I would say, but that's much more of the group that's on Twitter. There are some medical students, but they're not as actively involved on Twitter as on Instagram. In terms of what I post, I will occasionally put like cases on there. I'll post cases on kind of both platforms, but if I were to say, oh, what would I choose? Like Instagram is going to get more interaction with the case in general because of like the medical students, et cetera. So the content that I put is sort of described at the level of the medical student, like what was the injury? What did we do? What's the kind of basics of the post-op rehab, rather than a very super high level discussion about a case. So I tend to gear it more towards the students. And that's just part of what I post. But when I do post those educational type things, I tend to gear them towards the students.
So Mary, no Facebook for you and no real directed attempt to talk to patients on social media.
So I do use Facebook a little bit, but my Facebook account is my personal account. So I actually do put pictures. That's where I share pictures of my family. And there are like some of the teams I cover, et cetera, like some of those people are like following me on Facebook, and I'm okay with that. That's one small group, and that has always been my personal account. And I just don't feel the need to create a separate professional Facebook account. So I post some of the professional things. And actually I've gotten in the past, probably, 6 to 8 months, I've been posting more of my professional things on Facebook in addition to the family stuff, because also I think, my family and everybody else that's following kind of likes to see that mix of things posted on there. I don't interact necessarily directly with patients there. Some patients find me there, but I don't have an abundance of patients following me, and I don't tend to like interact or discuss like patient care related things via Facebook.
Perfect. Jen?
So I do not interact with my own patients on social media very often. Sometimes they'll find me. A wonderful Instagram that is guided at patients and education for physical therapists is Nima Mehran. Dr. Nima Mehran, he has, I think, 30,000 followers on Instagram, and that's been his intent. And he does a great educational piece. For me, my audience is more the work-life integration piece for women and surgeons. So that tends to be my audience. And that's both on Instagram. Twitter is more physicians. Facebook also has, so women in orthopedics are unicorns, even though Mary and I are both here together. So one huge thing that has happened for us is we have a Women in Orthopedics Facebook page, and there's 1,500 members, and it's a very interactive, supportive group. I have a couple of groups like that. I have a Peloton physician moms group. And so I tend to do Facebook in those groups. And for instance, today I have a friend who has a diagnosis that I needed a recommendation for a physician. And I went out there, and she's in Colorado. And I went out there on those pages and I got 10 suggestions for her. So I'll point that out as well. That support in those groups is tremendous.
Thank you.
It's a Peloton group for everything.
There it is. Joe, anything to add before I turn it over to Alex for the next question?
I actually have interacted a little bit with some patients on both Twitter and LinkedIn. Patients have found me and have traveled to Charlotte to see me. So they'll direct message and actually had one patient that found me on LinkedIn and referred 3 more patients. And so it's not the reason why I got on there, but it is a possibility. And so if you do niche type stuff in orthopedics and you potentially have patients that would travel, it can be a vehicle for that as well.
I'm interested because each of y'all had, kind of say you have some focus when it comes to what your posts are about. And that seems to be reasonably important in order to kind of keep that focus, because it can get really easy to sort of dive down that rabbit hole on social media and kind of get involved in a discussion, even if you're keeping it just professional, which it seems like we can kind of ask that later, the blend of personal and professional. But how important is it, do you think, to have sort of a, Joe, you mentioned kind of a niche in terms of, not only your clinical practice, but what your social media presence is to make it more relevant, rather than just kind of like retweeting, reposting kind of everything?
Yeah, I mean, I do think it's important. You have to know who you are and what your message is going to be. But, I think one of the things that I got advice early on is be careful what you like and retweet. Make sure you read it. I think that, people may accidentally like something and it's a long string of something else. And it might be something that, what I tell people is it's not what the intent was when you sent it, or it's not what the intent was when you said it. It's how it lands. And if something's going to land in a way that is offensive to other people, then I don't want to really be a part of that. And so I think that's part of it as well, as being responsible with it and reading through what you might like or retweet to make sure that it does agree with you and is aligned with your core values.
Jim, how about you?
Am I allowed to ask Chuck a question?
Free reign.
Oh.
Anything you want.
I'm flipping the script.
We can flip it totally.
So I've been intrigued because I've seen you started a separate account for a different diagnosis or a different group of patients. And I was really intrigued with that, to really hone in your audience. Could you tell me about that?
Yeah, I'll give you, not that you asked for my life story, but hey, real quick, I'm going to give it to you, which I think will be interesting to some of the listeners. So I actually started with a blog. That dates me, I think, a bit. I still write my blog.
Wasn't going to say anything, but
you already dated me when we started. But my blog had the express purpose of talking about congenital hand. And then to try to get my blog out there, that's when I actually started tweeting. And I would really just tweet my blog and a picture or something like that. And then I got a little more sophisticated on Twitter. You might argue not that sophisticated, but I thought I got a little more sophisticated on Twitter. And then I realized, I think what you guys said about Instagram is true. It is absolutely a different audience. And so I thought, well, I'll just do some congenital hand things on Instagram. And that was fine. But my other love is sports. And I have to say, I can say this, it's only been maybe 4 months, 6 months, something like that. I think that was a mistake. I have 2 different Instagram, actually I have 3 Instagram accounts. One's personal, and I do separate personal and professional. The other's congenital, and the last one is sports. I think having a congenital and a sports makes no sense. My followers are the same. I see the same stuff circulating. And so that was a mistake. I do like having a presence on Twitter and Instagram and Facebook for patient-focused things. But as everyone has alluded to, this is it's one more thing in our busy lives. And I think the more focused we can be, I just think it's so much better. And I feel like I'm losing a little focus by trying to be in too many different places.
Chuck, I think it brings up another question is, what's the right sort of cadence? How often do you have to post to sort of be present? Because like you said, we're busy. It's not like we're not influencers, which we don't have hours to kind of plan posts, and then we're not getting reimbursed tens of thousands of dollars per post. So we do have that kind of short time to try to get something together. So how often do you think you need to sort of make sure you have a tweet go out or an Instagram post go out? Is it daily? Is it every other day? What's kind of the right cadence? What do you think, Jen?
So I think that for me, and from what I understand, Twitter is a free-for-all. And that Instagram has more of an algorithm of understanding when your followers are picking up your posts. There used to be these recommendations of the following days and hours had higher hit rates, but if our audience is physicians, all bets are off. I found the same thing with my podcast. You're not supposed to drop them on the weekend, but when I drop them on the weekend, everyone listens to them because they're doctors. The other thing that you didn't ask, but I'll answer anyway, is I think that on Instagram, you can go back and edit. So I might actually fire it off a little quicker. Twitter, you cannot edit. And I had a post about a week ago that I added a word to that I wished I hadn't. It went very far and wide, and it said something about I have a partner who was vaccinated for COVID and got COVID. And so I put something out on Twitter that I was scared, and I wrote about it. And I'm part of a campaign called This Is Our Shot. And we're supposed to be out there really soothing and promoting the vaccine. And here I was drawing fear mongers. And so I had to pull the whole post down rather than edit it. So that's just another piece of the firing off that for people who are starting, do recognize you cannot edit on Twitter.
That's a great point. And yeah, obviously that. Mary, jump in.
No, I was just going to echo that. That is an excellent point and really, really important to bring up, because on Facebook and on Instagram, you can edit. On Twitter, you cannot. And so yeah, it's like your only option is to delete it at that point. But speaking a little bit to frequency of posting and whatnot, I don't know the perfect formula. I don't know that any of us do. I think the key thing is to have a regular presence, right? To be there, to be interacting, even if you're really busy, you have a few minutes to just flip through. Okay, I like that. Oh, that's cool. What Joe posted, like maybe you'll retweet it, whatnot. And then there are times when if you happen to have a little bit more time, you may think like, oh, it'd be cool to maybe post this thing next week. And you can kind of like brainstorm what you're going to say or what pictures you're going to use. So when I have time, I'll sometimes think about some things to post ahead of time. I don't personally use, like there are programs that you can use to like schedule posts. And actually I'd be interested to hear Jen and Joe's opinion on this. I don't have any familiarity with like with Hootsuite and whatnot, and I'm sure there are others. I just don't have familiarity with it. So I'm not currently using anything like that, but that is definitely something that a lot of like people individually can use, groups use, like practices use to just have stuff scheduled and that it just gets posted and you don't have to actually physically post it on whatever day it is. But me personally, like I try to post probably at least a few times a week. And then I'm just interacting with other things that people are posting on Instagram and are tweeting on Twitter and participating in the, somewhat more educational and serious conversations. And then just the fun things like show us a place you traveled, like those things are really fun too, because that's how we learn about each other.
Yeah, I think I'm pretty haphazard about it. I don't really have a plan for when I post, it's the life of a surgeon. I do a lot of research and things. And so when time permits, you put it on there. But I do like to cruise through and read stuff and stay relatively current on what's going on. For me, when we had in-person meetings, we'd go to like the AOA meeting or something like that. I'm posting like every 3 minutes, and it's just like, me and a selfie of yet another friend of mine, and it's fun. And you actually get to kind of figure out who's at the meeting and what's going on at the meeting. And then you start looking for the person because you saw someone else tweet a selfie of them. And so I think that for me, those are the times when I am most active, and when we did in-person grand rounds, I'd be so excited to give a grand rounds at a place and, I'd tweet about it. And so those are the times when I get to be a little bit more active, but I don't think I have a really good plan for it at all, but it seems to work out okay.
Yeah, it seems like again, dating myself with the blog stuff, you had to post at a certain cadence and you have to post a certain length post in order to search high. And I don't think that's really the goal. There's no search goals here. You're just trying to connect with your audience. So I do think there's got to be some cadence, but with physicians and surgeons, and maybe it's different than other areas. And like Alexander said, at least I'm never going to be an influencer. I think Jen may be the closest thing we have to an influencer. Who knows? Who knows? All right. I'd like to do a couple of things for those who may not be experienced on social media. I think you guys have all shared really powerful things that you like about it, getting to know new people, learning about different things, different perspectives. Those are all great. Very briefly, will each of you say to someone thinking about social media, which platform would you start with? And I assume you would recommend just starting with watching and for a while, but is Twitter the easiest to get started on, or any thoughts on that? Mary, do you want to start?
I think they both have their pros and cons. Like I think they're sort of equally easy to learn. Twitter definitely, like we've said, is quicker. Like they're quick things, and so you don't really have to think about the length of the content. But I could see both ways. Like I said, personally, I actually started with Instagram, and that worked well for me, and then moved on to Twitter a couple months later. But I do think focusing on one initially is really helpful, and just kind of watching and getting the lay of the land. Like another great way is to start following people that do things that you like, that are either, in your same specialty, your subspecialty, that are somehow peripherally related to your field. For me, with physical therapists and athletic trainers and other people interested in health and fitness. And so I started following those type of people and see like what they're posting. And so that's how you learn a lot. You learn about what's being posted. You also actually learn general educational content. So I think that's a good way to sort of get acclimated to a platform.
Joe, anything to add? Do you have a belief of which might be easier?
A little bit out of left field. Honestly, the easiest way I think is Doximity, which hasn't even been mentioned yet. It doesn't allow you to post. So you can't really create your own content. So there's not this pressure to say something, intelligent or snarky or funny or have a video. And what it does, it instantaneously connects you. When you put in your CV, it instantaneously connects you with people from your medical school, with people from your residency, with people from your specialty, with people from your region. And that was actually one of the first ways I got into social media was on Doximity. And it was fast. You connect with all these people like, oh my goodness, this person's right down the street. I graduated from the residency where Mary is a faculty. I found Tulane grads in the area, and then ended up, linking up with them, and, have real life friends. I had real life friends all of a sudden. And you get to stay current. You got to learn. And so for me, that was probably the easiest to get started for someone who really didn't want to post initially, and then later on got into some of the other platforms.
Perfect. Jen?
One negative about about Instagram is that you cannot post a link in your post until you have 10,000 followers. So that makes, you can post links in your bio, but that can make it a little bit more irritating if you are somebody who's trying to link articles and what have you. The other thing that I will mention, so that for me is a reason to start with Twitter if you like to do that sort of stuff. The other thing that I'll say is, since you mentioned blogs, and since I am younger than you graduated a whole, I think, year ahead of me from Williams.
I'm way older.
Way older. Is I also have a blog, and on Doximity and LinkedIn, you can actually publish things. The process is very easy. And Instagram and Facebook, you can have your own diatribe pretty easily. So those are just different tricks for those people who are writing and creating even lengthier content.
I think one of the things that I've struggled with is, I don't consider myself particularly good with words or snarky or sarcastic, or, I find it difficult sometimes to try to find that, get that post out there that's really going to get a lot of followers. And actually what I found was with kind of this past summer with medical student recruitment, they were so starving for anything related to orthopedics that I literally could just post a picture of me in the hospital, and I got 150 likes immediately. And so I do think it's a little, Joe kind of mentioned that, you're a little intimidated the first time you get out there because you want to sort of jump in and really kind of have that presence. But maybe, how long did it take you to kind of feel comfortable just anything posting and not necessarily having to look at it and make sure it's the right craft and make sure it's saying the right thing? Or do you still kind of obsess over every single post that you send out? I see Mary nodding her head. So
I don't think you ever completely lose the motivation to check what you're posting, right? Just read it over. Does it make sense? Like we're all perfectionists too. We're like trying to make sure there are no spelling errors and like stuff like that. So I still do that, but I mean, the content definitely comes faster the more you're doing it, the more you're used to posting, and you realize like it doesn't have to be like this very like profound statement that you're including with your post. But I do still kind of review it before I submit, especially like on Twitter where you can't make any corrections.
Yeah, I think the only thing that I would add is some people have a lot of followers and they create this really interesting content and it generates a lot of activity. One of the strategies that I use, because I don't have as many followers and, I don't think that I create such incredible content, is that you tag bigger organizations. And as you tag these bigger organizations, when they retweet it or like it, then it reaches a much bigger audience. And that's one of the strategies that I use. And so I try to figure out who's the right audience, who should I tag more than, this eye-catching content that I'm not as good at creating.
That's a really important point, Joe. And that's something I think with time you learn too. So it's like not only people, if we're posting something about Joe or Jen, like we're going to tag them, that makes sense. But also think, okay, well, let's tag the Academy or AOA, or let's tag, whatever organization is relevant. Like that really helps. The other thing that helps a ton are hashtags. And so, I mean, sometimes people will just put sort of funny tags like, oh, this was really fun, hashtag this was really fun. But other times it's, women in ortho or leadership or things that really are going to get a lot of reach because those are search terms and people may find your posts and your tweets that you were never like directly targeting. So that is a really, really important component of broadening the reach of what you're putting on social media.
Jen, anything to add?
Yeah, I think that the amplification as a goal is an interesting one. I definitely do that and, get my ego fed by the likes or the retweets or whatever. But the other thing that is really interesting is kind of the self-conscious mode of like, who am I to be putting a picture of myself or saying something like, why does anybody care? And so getting over that, like sometimes I'll catch myself like, why on earth would anybody care about this? So I start to be careful. There was a moment where I came over the edge of caring. Last summer, there was an article that was published in the Journal of Vascular Surgery that set off this Medkini fire really on social media. And I did a thing. I took a picture of myself in a bikini and I jumped into the mix. And I got a ton of feedback, all really supportive and positive. But I had a conversation with Christy Weber, who was the president of AAOS at the time. And we were talking about something else. She didn't call just to make fun of me, but she's also not on social media. So the only reason she knew about it was because Liz Madskin sent her a picture of it. So anyway, but she said, I'm interested. She said, I support you and I'm glad that you're doing this, but where is the line? And it is interesting. So I went so far over the line of putting myself in a bikini on social media that now nothing else is intimidating to me at the moment.
I love that. So I want to briefly share in case, so I think the listeners are like, sure. Like here's what I'm thinking. I really carefully think about every tweet and every Instagram post and make sure I'm not saying something stupid, and I still say stupid stuff. And so I really am super careful, and I would encourage those who are novices to be careful. So along that line and along the let's not cross the line, let's talk about the don'ts, because I think this is really important. And I still have, I think you guys can help clarify some things for me. So let's start really basic. So Joe, what do you, I assume you post things about problems that you've treated. How do you protect patient confidentiality and HIPAA? How do you respect those boundaries?
Yeah, so I think HIPAA's a big don't, right? And so if you're going to do that, then I think it's very important to make sure that you have the right video and photo consents if you're going to show anything about a patient, even if it's going to be anonymous, like X-rays only or something like that. And that's something that we're pretty, we don't even toe the line. We do it exactly as it's supposed to be done. And it's really not that hard. It's a little bit extra. And I don't post a ton about patients. I'm fortunate that I have a few patients who are actually active on social media. And once they identify themselves, it's them. And if they want to show their X-rays, if they want to show them walking, that's them. And so I think that's a big don't. And then for me, the other big don't, and I'll stop there and let the others weigh in, is politics. I don't even like or retweet anything that has any political connotation. And I know that some people do, and it's not a judgment on them, but I think to me, it's a potential firestorm. And so I will not even like it if it has any connotation of politics.
Mary?
So I agree completely with the patient confidentiality or the importance of maintaining patient confidentiality. And I don't post about patients that often either, and almost never include an actual picture of a patient's face or whatnot. And if I ever do that, then I actually explicitly write like posted with permission. Most of the things I post, are arthroscopic images or X-rays or whatnot, but still always important to maintain confidentiality. So I'll often even sometimes just like change the age or change just change little things that doesn't affect like the actual like injury or the treatment or whatnot. Other don'ts, some of these things we've talked about are just not sort of haphazardly retweeting something, like being careful about that. I agree completely. And I personally, I don't tend to get involved in any discussions that are even like somewhat controversial. And I don't really post anything controversial, I don't think. And I don't personally have a huge interest in politics or religion or participating in those types of discussions. I think that can get a little bit complicated, but I don't have a huge personal interest in that anyway. So it doesn't become an issue, but I think you just have to be careful of what you're doing and who you're interacting with. And so just think about it, especially as physicians. Of course, people are looking to us, and so we have to be careful.
Jen, what are your big don'ts?
I actually don't post during, or I try not to post during office hours, because I want to show my organization that I'm not busy, on Twitter during office hours. Now, it might be, lunch break or like a long time between cases, and I might break that rule now and then, but that's one. Number two is I take a good look if I am taking a photo. Like, let's say I took a selfie of myself in this office and by accident I had a chart back there. Like, I take a good look at photos and blow them up to make sure that I don't erroneously get something in there. And that goes for also in the operating room. If I do take a photo in the operating room, that's a place where medical record numbers and things like that are around places that you don't recognize. So those are some things that I have learned to be careful of.
So I'll share one thing that makes me cringe, and I'm looking for feedback. Maybe I make you cringe, or how you think about this. But I think arrogance is really tough, and self-promotion can cross into or over into arrogance. Anyone want to jump in and kind of talk about how you think about those two things?
It's interesting because you see a fair amount of that as well, and it's not just self-promotion, arrogance, but harsh criticism as well, and those just leave such a poor taste in my mouth. And so I think that some people would say that anything that we do on social media is self-promotion, and I've heard people say that. Some of my colleagues have been very critical of me, even though, like I said, I got into this around opioid education. They say, "Oh, you're just out there self-promoting. You're just trying to drum up business, whatever." And, for me is, I just try and take a humility lens on everything that I try to do. And if I am tweeting about, I just tweeted about a 1-year anniversary of one of our osseointegration patients, because it was a big deal for him. And so some people might say, "Oh, we're out there just drumming up business," but that was really important for that patient. He's put up the video. And so I think that if you take a humble approach, if you are going to engage with someone about a case that they've shown or something like that, there's no value and there's no reward for you if you're nasty to people public format like that. So I just think that's one of the real challenges that turns me off.
Jen, you want to jump in next?
I fully agree. I think that confrontation does not lead to good things on social media. There are certainly people with anonymous accounts. We haven't really talked about that. And I will say that the person that I recruited to lead our social media ambassadorship program for the AAOS, I found him, he was anonymous, Neanderthal. And he's been public about this, so he would not be too upset with me. But Dusty Schuett is the same person. And so he has two accounts, and he gets a little more rambunctious, of course, with his anonymous one, but he is still quite respectful and tries to be, even with his anonymous account. And I think that there are some anonymous accounts out there that people really take that camouflage and run with it in a way that I think can be problematic and sad.
Yeah, I didn't even think about that, but I don't need another account. Mary, is it okay to retweet when the Sports Medicine Journal tweets that your new article is fantastic? Is it okay to retweet that? And is that above the line?
No, that's absolutely okay. And I think many people, when they retweet it, it's something like, "Thank you very much, AJSM, for publishing our manuscript," or, "So excited to see this, like we found X, Y, or Z." And you're right, it is. I mean, a lot of what we do is promoting things that we're doing, but we're also genuinely interested in sharing this information, in improving care of our patients. And so it really is underlying much of this is an altruistic, goal. So I think absolutely that's appropriate. And that's how we share a lot of information with each other.
I'm interested because you can also kind of go into the whole giving medical advice over social media line, which is something, you see a lot of people sort of have the disclaimer, tweets are my own personal opinions, not medical advice. Obviously, there is a bit of advice that we're giving every time, especially we talk about a case or try to have some sort of discussion, especially related to things that we take care of. Where do we see that? Because that can be pretty dangerous. And we see that with people that have, medical credentials, dishing out advice, promoting products, promoting implants. Where do you see that line kind of being drawn? Because I see that being kind of fuzzy in terms of, you want to promote some of the things you're interested in, but you also don't want to necessarily, along the same lines that Chuck said, sort of promote things commercially.
I mean, I guess I would say, yeah, when we're discussing cases, we are sort of in general providing advice about care, but we're not directing that to any one person. And I think all of us would agree that we don't provide specific care recommendations to patients over social media, but a general discussion about a case that happens quite commonly. And I think it's helpful. I think we all learn a lot from social media in that regard.
I think one of the things that I respond to on cases like that, the way that I do it, I'll often just put a link to a paper. And now the new mobile PubMed platform makes it so easy. You can just copy the reference directly. And that's often the way that, because you'll see people like arguing and going back and forth, and I'll just post a reference.
All right. Well, I think this has been absolutely fantastic, and it's exactly what Alexander and I were hoping for. You guys have certainly shared a great deal of wisdom. Maybe in closing, I could ask each of you to just share with the audience one or two takeaways about what social media means to you, why you do it, what you get out, whatever you want to share as just food for thought as we end this podcast. And Jen, I'll start with you.
I would say my two takeaways are: be careful of addiction. And I really have to, it's just my social media addiction gets reserved for after I've done what I need to do. So that's number one. Number two is, I never thought I would say this, but I have friends that I made on social media, like true friends. And one of them is Nancy Shipley, another one is Dusty Schuett. So it can happen. And I think if you're genuine and you kind of put yourself out there, there's some fun things that can happen personally as well.
Thank you. Mary?
I guess first I'd say don't be afraid. Just start somewhere and kind of just get a feel for what it's like. And then you'll easily kind of slip right into that. And then second is that I think there's just so many benefits to doing it like professionally, personally, like networking, as Jen said. There's so many things that you can get out of it and that you can contribute to. So I think it's a lot of fun, and it supplements everything that we're doing clinically and helps you grow professionally. So I'd encourage everyone to kind of jump in.
And Joe?
Yeah, I would say it doesn't have to be hard and not to be intimidated. I don't count the number of followers or likes or whatever that I get. I just, like I said, I don't really have a great strategy for it. And so it really doesn't have to be that hard. The other thing is, in addition to friends, one of the things that's actually been the most fulfilling to me is to have residents or fellows that I've trained, and they get on the social media and they will say something so profound and so grateful and repeat something that I said once that was impactful to them. And it takes you back. I mean, there are moments I'm looking at my phone, my wife's like, "What's wrong with you?" And I'm getting a little bit emotional about it. And it's a resident that I trained 8 years ago that, recalls something like that. And so to me, that's the hook that keeps me out there, is to be connected to our colleagues and really the mentees that we've sent out into the world to do great things.
I think this has been awesome, and it's definitely motivated me again to restart my my social media presence kind of professionally. And I've got a lot of great do's and don'ts. I think one of the things, and I actually kind of realized this last summer when I really started trying to have a presence, is it really isn't hard. It seems intimidating, but and like Joe said, you don't necessarily have to figure out how many likes or retweets you get. I remember the first post that I had a retweet. I ran downstairs and showed my wife, and she just rolled her eyes at me and was like, "What the heck is wrong with you?" So that's definitely, don't get too caught up in the hype. I think none of us are going to be influencers. We're not going to have 1 million followers. That's cool. We can connect with people. And the other thing for me that was really was cool was being able to reach a really broad audience in COVID, being able to talk to a bunch of medical students this summer, talk to them about our program, kind of just talk to them about orthopedics, what this is like. This was such a weird recruitment cycle for all of us. So really being able to connect to a group of people that I think felt like they were really isolated. That was really cool to be a part of. And so I think that's really kind of helped push me forward through this.
All right. Thank you, everyone. So I'll say one final thing to either the experienced social media person or the novice. It's really easy to get started on Ortho Twitter, and you can start with 3 follows. That is at Joseph Shue, MD, at My Mom the Surgeon, and at Mary Mulcahey, MD. It's a great place to start. They're must follows for anyone on Ortho Twitter, especially. And I want to thank each of you guys for being here tonight. Thank you so much.
Thank you.
Thank
Thank you.
Take care, guys.